scientists for so many years, and now the pandemic has come. What more we can do?
Angela came up and said, we should be testing sewage. It was a new idea for me.
The Precision Health Initiative is that it's not based on our priorities, and it's grounded in local priorities that are durable for your systems where you're working.
Like I called upon SCOAL as being one of the flagship who believed in us. Right behind them were Crypto Relief Foundation, who said, yeah, we want to get in the game.
For me, the science made sense and the impact it was having in public.
Let's develop the system where we can help the government in reverse to help ourselves. Because as a community, if there is a pandemic, we are going to face it.
Environmental surveillance really started making sense for us. We could tell people that we are seeing more number of cases in this particular ward in the sewage.
So working with the government in the initial step itself gives a lot of insight what government thinks and also the solution coming out.
So the role of the government is to regulate the things, facilitate the environment, and not to do the business, which is for others to do.
There is a need for government to recognize that there is area where many people need to come in and partner and work. But once we have it running like clockwork, we've seen the government scale.
Wanted to also then collaborate with them to see where this water is coming from and how many people are living in this.
I want this kit to be able to detect this gene, this gene, this gene, and I want it to be quantitative. You make the test that I want.
So the approach that we took was we built hardware systems that we could send into wastewater networks, and we would collect data.
We are developing a software called as AMRX. Now this software connects what the prescriber is prescribing with what is being dispensed by the pharmacist.
Who owns wastewater? Who owns the data of wastewater? What will that information? I know that SCOAL, for example, or others who have been funding, talk about an open, transparent platform.
You're hearing about the successes, but we failed, we fell, we scrapped our knees and we got up again.
If we can move a bit more towards flexibility, a bit more towards innovation, and we can start to think more intersectionally about some of these solutions, I think we end up in a better place.